Joel, again, by its very nature, the pandemic has given rise to epic mental health issues and a heightened need for employers to understand how to meet their obligations when accommodating mental health in the workplace. What are the key things employers need to know?
Well, as you say, in times of heightened stress like this pandemic, of course, many people's mental health conditions become more challenging and others are going to develop new mental health conditions. Statistics Canada conducted an online survey, for example, of tens of thousands of Canadians in late April and early May. The results were just released last week, and they're pretty significant. 52% of participants reported their mental health was somewhat or much worse since physical distancing requirements came into effect. And of those 52%, 41% of them reported symptoms consistent with moderate to severe anxiety. Now, experts are warning that this increase in mental health issues is going to lead to an echo pandemic. You might think of it as a post-pandemic pandemic, with the pandemic's impact on physical health for those who contract it being echoed by its broader impact on societal mental health. Now, virtually every province across the country, as well as, of course, the federal government, have announced expanded funding and programs to support Canadians with their mental health. And that's going to be the case during this pandemic and for some time afterward as well. And employers should become familiar with those supports because in many cases, they are going to help employers with their accommodation obligations when it comes to mental health. Now, employers should expect many more requests for mental health accommodation than usual, particularly given the many different situations where employees may require accommodation for mental health disabilities in relation to COVID-19. Now, just a few examples are employees having anxiety about even leaving the home to attend work or getting to work on transit or other means, anxiety about being in contact with coworkers once they're at work, anxiety about wearing masks and the impact on the ability to breathe in workplaces that will require masks for those employees who really don't like that feeling of having their breathing restricted. And then in addition to those anxieties about COVID-19 specifically, others, again, will have mental health issues that aren't directly tied to concerns about the pandemic, but that are worsened because of all these broad added stressors that we're seeing right now, including the impact of isolation, personal health concerns, worries about family and friends' health, the economy, and so many more. And all of these can, of course, also impact employees' ability to meet the various aspects of their job responsibilities, as most employers have dealt with mental health issues in the past as well. Now, one important point that I want to make here is that just like with physical disabilities, employees are entitled to accommodation for mental health when they have a disability. But not all issues are going to amount to a disability under human rights legislation. So simply experiencing challenges with mental health does not necessarily rise to that level of disability. Like, for example, anxiety that so many people are experiencing in some level is not necessarily going to amount to an anxiety disorder or other disability related to that anxiety. And so again, if it's not a disability, employers technically are not required to accommodate in most cases, but employers should be very careful about this and should always obtain enough information from the employee to be very confident that the employee does not have a disability requiring accommodation before denying the accommodation to the employee. In many cases, that's going to include asking the doctor for written information like you just spoke about. Now, the last point I want to make here around mental health is that, again, employers don't only have to accommodate when employees request it, they also have a duty to inquire into whether an employee requires accommodation when the employer has some reason to believe they might. And again, this duty most commonly comes up in the context of mental health disabilities because there's still a stigma around mental health. So employees are often unwilling to admit they have a problem or they're not comfortable asking their employer for help with their mental health. And when this comes up in mental health circumstances, it's often when an employee's performance or demeanor suddenly changes. In these types of cases, employers will often have that requirement to ask whether the employee requires accommodation in order to ensure they've met that duty to inquire and met the broader duty to accommodate the employee's mental health limitations.